Hello, good afternoon. My name is Dr. Trudy Ufondu of Snowspirations, and it's another episode of Open Clinic with Dr. Trudy Ufondu of Snowspirations Health. And today's topic is a topic I find so very, very important. So, we're going to talk about HIV, and we're going to talk about the possibility of two couples who are HIV positive having HIV negative babies. Now, it's a topic you have to pay attention to. This topic is very dear to me because currently, depending on where you reside, there are so many things you've heard about HIV. There are so many misconceptions. There are so many stigmatization. Growing up, hearing about HIV, there are so many wrong information you know about HIV. There are so many things you need to get the facts straight. So it's my aim to help you this afternoon to understand what HIV is all about, to also understand the difference between HIV and AIDS. HIV is not AIDS. AIDS is not HIV. AIDS is the end product of HIV if nothing is done. Now, previously, when you see someone that had HIV, or when you yourself get that diagnosis of HIV, you practically feel is a death sentence. So I make it very bold to tell you this afternoon that HIV is no longer a death sentence. You can have HIV. People might not even know you have HIV. You can live your normal life so long as you're doing the right things. So HIV, it's no longer a death sentence. You can still find someone you love. You can fall in love. You can become pregnant. You can have your babies. Your babies will be HIV negative. You can completely take over your life. So thank you so much for coming this afternoon. And without wasting much time, I'm going to start. So the scenario in our community, which is a maternal and child health community, is a situation where we have two couples, HIV positive, HIV positive. The man is positive, the woman is positive. Now the question is, can both of them have an HIV negative baby? Guess what? Big fat yes. You can have one baby, you can have two babies, you can have three babies, and they can all be negative. Now, the question is, have you really understood what HIV is all about? So let's start with that. So, what's HIV? The abbreviation HIV stands for Human Immunodeficiency Virus. So, HIV is a virus. HIV is a type of deadly virus that can attack your immune system. Your immune system is supposed to protect you from diseases, inflammation, infection, whatever. The reason why you're hearing me today, the reason why I'm hearing you, the reason why I'm alive today is because of my immune system. So every day you go out there, you are exposed to a lot of things that can harm your body. Now, if you pick up this HIV, which you can pick through so many means, sexual means, drug abuse means, blood transfusion, exchanging needles, and a whole lot of other ways. So it's not only through sex that people can pick up HIV. Some people might even have HIV without even knowing. Some people might be health workers that got exposed to HIV products. But guess what? If you have HIV, you have the virus, just like you have COVID virus, just like you have your flu virus. It's a virus. If it's properly diagnosed and on time, we can actually mitigate the death end of HIV, which is AIDS. So just let me explain again. When you have HIV, it's not AIDS. AIDS is the end product of untreated HIV. There are so many people in our community who might have HIV. They might not even show symptoms. They might not even know until 20 years later, 10 years later, depending on how strong their immune system is. The only way you can know your status about HIV is to go for test. First of all, you go for screening test, then you go for diagnostic confirmation test. Now, if you have HIV, you are going to go through different phases depending on how early it was diagnosed, depending on how early it was treated. Now, HIV have some treatment modalities, but it's not curable. When you have HIV, you have it for life. But there are treatments that can prevent you from graduating from HIV to AIDS. Matter of fact, in 2021, even with new infection, there are so many people that got caught up in the HIV phase. It's only few people that actually graduate to AIDS. So what are the things that can help you to make sure you don't get to AIDS? Awareness, acceptance, early treatment. There are specific treatments you can take for HIV, then you can reduce your viral load. So I want everybody to pay attention to what? Viral load. The determining factor of the ability for you to transfer HIV to another person is what? The viral load. Viral load means how many of those HIV do you have in your system? So the drugs we normally give people with HIV, it's the drugs that will reduce the viral load to the barest minimum. So the fewer virus you have in your body, the lesser your ability to transfer it to people. So the way we can make sure that a baby will be HIV negative is to make sure that those two partners are constantly and religiously taking their antiretroviral therapy. So there are some specific drugs we're going to give you. You are supposed to take it for life. Now, if you are diligent as a man, if you are diligent as a woman, and you start taking your HIV drugs way ahead on time. Let me give you an example. You suddenly find the man you love. You suddenly find the woman you love. Both of you accept that you are HIV positive, right? That's your acceptance. Then you begin to go for counseling. Counseling is important. When you go for counseling, they're going to tell you pretty much everything I'm going to tell you. That HIV is not what? It's not AIDS. That HIV is what? It's not a death sentence. That you can still start your family. But you begin to plan. You begin to take your retroviral therapy. You begin to take your treatments. You begin to live healthy. You begin to eat good food. You begin to be careful. You begin to avoid stress. You begin to plan. You begin to understand that if anything happens, this is your story. This is your situation. You own your situation before you begin to become pregnant. So planning and counseling, it's number one thing you have to do if you have HIV positive. You don't gain anything hiding your diagnosis. HIV should not stop you from loving. HIV should not stop you from having your babies, but you need to do the right things. You need to go for counseling. You need to follow due process so that your baby will not be HIV positive. Now, how can your baby avoid being HIV positive? There are specific treatments. There are specific drugs we will give you even before the thought of becoming pregnant. So we're going to place you on that drugs. You are supposed to run on those drugs. If you take those drugs religiously, your viral load will drop. When your viral load drops, there's a particular cell in the body we call CD4 cells. They are CD4 count. They are the immune cells that helps to protect our body. Unfortunately, when you have HIV, HIV goes to attack those immune cells. So the CD4 cells will drop. But when you take your drugs religiously, when you eat healthy, when you avoid stress, when you exercise, when you're in a good place, when you have a good mental health about your HIV situation, you're going to gradually build your CD4 cells. When your CD4 cells is built, you will avoid opportunistic infections. One of the major problems in HIV is the ability to develop opportunistic infections. Opportunistic infections are infections that previously you can fight off easily. But when your immune system is damaged, you will no longer have that ability to fight those infections. So any little thing passing your way can easily kill you. HIV as a virus is not what will kill you. It's the infection you are exposed to that will kill you. Now, HIV have phases. The first phase is called the acute phase. So many people will be on this phase, you won't even know you have HIV, right? Now, the second phase is the latent phase, the chronic phase that if you're not careful, you will keep transmitting it to people. But if you're in acute phase and you take your drugs and you're careful and you use protection and you avoid drugs and you're careful, you can actually find yourself just caught up in the chronic phase. So when you're in chronic phase, what does it mean? You're going to be in that phase for good. You're going to be taking your medications. Your viral load is going to be down. You are not going to graduate to AIDS. AIDS is when your HIV is not treated, when it's not diagnosed. Then you begin to go to the other end of the spectrum. AIDS stands for Acquired Immune Deficiency Syndrome. So when you have HIV, human immunodeficiency virus, If it's not treated, it's going to damage your body system. You're going to graduate from acute phase. You're going to get to chronic phase. Then you will end up in AIDS. AIDS is what will kill people. If you can't get to AIDS, you're not going to die. Now, how can we ensure that the baby is going to be negative? Couple of things. Before you even think of becoming pregnant, we'll place you on the antiretroviral therapy. So you're supposed to be taking the drugs, you and your partner, then we keep monitoring your viral load, we keep monitoring your CD4 cells. Then once we are good, that you are able to go ahead, we are going to carefully take steps how your partner can get you pregnant. So your partner's sperm is still going to be the same. Some men can still have twins, triplets, even with their HIV status. So what's going to happen? We are going to maintain both of you on those drugs religiously. So this is not where you say, oh, let me go and pray about it or use herbs. As of today, there is no cure for HIV. There is no vaccine. Hopefully, over time, we're going to get vaccine. We're going to have a permanent cure. But gone are the days when you will have HIV and you start thinking you're dead and gone. You are not dead and gone. Matter of fact, if you are careful, you can live more than people that don't have HIV. In America, there are so many celebrities that have had HIV for 30 years. HIV has been around as way back as the 18th century. It's actually an infection that started in chimpanzees in Africa. Then because Africans were hunting chimpanzees for some reason, they got exposed to the HIV blood and it transformed from animals to humans. So it's been around in America since late 70s. It's killed so many people out of ignorance, out of lack of awareness. So the stories you've heard in the past about HIV is dead and gone. You can have it, you can get to 70, you can get to 80, you can have your 4 kids, you can have your 3 kids, you can have your 2 kids. And if you don't tell people you don't have HIV, nobody will know. So we need to know this. Now, when you eventually become pregnant, understanding that when you're pregnant, your immune system by default is dampened. You will continue taking your retroviral therapy. When you are pregnant, your partner will continue taking his retroviral therapy. Both of you will be careful. The determining factor of transferring that HIV to your baby is the viral load. So long as your viral load is low, we are gonna avoid transferring it to your baby. But we understand that you and your baby can communicate, right? So while you're pregnant, there's a connection between you and your baby, your placenta. So babies can pick up a lot of things from you. So long as your viral load is low, the possibility of transferring it to your baby is limited. Now, when you eventually give birth to your baby, we will immediately start treating your baby as if your baby has HIV. So there are specific treatments we'll give your baby acutely. So it's more like a preventive route. So if we can maintain you on the HIV treatment prior to pregnancy, within pregnancy, after pregnancy, then we begin to treat your baby. Also, with what we need to do, guess what? Your baby is going to be HIV negative. The only babies that will be HIV positive are babies that were not followed up exactly the way I planned it. So if you are HIV negative, if you are HIV positive, it doesn't change the fact that you're still beautiful. It doesn't change the fact you can still find love. What you need to do is to accept what you have. There is no cure. There is no magic herbs. There is nobody that will pray it away. I'm telling you the truth, but you can accept it. You can do the right things. You can find someone you love. You can go to the normal route and you can have a normal baby. The babies that will love you, you'll love them. You'll spend your time with them. There are so many people over the world that have HIV. In America, if you love basketball, you know about Magic Johnson. Magic Johnson has had HIV for decades. But we don't know. There are still some people that will be stigmatizing you. But guess what? This is your reality. If you accept your reality, if you live healthy, if you take your medications, if you find love, if you observe all protocols, you're going to have your baby boys, you're going to have your baby girls. Nobody can stop you. Now, some people will be wondering, how soon should you start taking your drugs? Immediately you are diagnosed, you have HIV. Start taking your drugs religiously. Go for your appointments. Be careful. Definitely don't keep multiple sexual partners. Now, for you to be diligent, for you to be a good citizen, you must disclose your status to your partners. Some of you might have multiple sexual partners. If you are HIV negative, if you are HIV positive, it's important to communicate to your partner. If you are positive, tell your partner you're positive. Use protection. The only protection that can prevent you from picking HIV is what? Condoms, if it's used properly. So don't hide your diagnosis or don't use it as a weapon. Unfortunately, some people have weaponized HIV. So they begin to have multiple sexual partners to transmit it to them. That's simply wickedness. You can be a good citizen. You can have your baby boy, you can have your baby girl, you can have your loving husband, you can have your loving wife, you can have a normal life, you can have a normal job, you can be a happy person, you can do practically everything God made you for. So HIV is dead. HIV is no longer a death sentence. HIV is something you can have and you can try. Just like you can have COVID and you can survive from COVID. Just like you have flu and you can survive from flu. Just like you can have any medical condition. There are some chronic medical conditions that when you have them, unfortunately, we don't have a cure. If you have hypertension, if you have diabetes, if you have HIV, you're going to have them for life. If you have asthma, you're going to have them for life. But the key word is management. Now, when you have HIV, it's important that other comorbidities are monitored and properly managed. So what do I mean by comorbidities? If you have hypertension, diabetes, obesity, or cancer, then you have HIV on top. That's a deadly combo. You have a very high risk factor. So the things that kill people with HIV are poor management, poor treatment, poor mindset, poor acceptance. If you accept your condition and you begin to work towards living healthy, you can live a normal life. You can have your baby girl, you can have your baby boy, and nothing will happen. Okay? Very, very important. So gone are the days when people will begin to make you feel like you're not worthy. When they begin to castigate you, you go to church, you don't find love, you go to your community, they're calling you different names simply because you have HIV. There is absolutely nothing you want to do, you cannot do. And I'm talking especially to people in Africa, especially in Nigeria. Stop the stigmatization. Let people be. You can have a normal life. People that have HIV can have infertility problems. People that don't have HIV can have infertility problems. Everything that happens to other people can happen to you. Your mother will still be your mother. Your father will still be your mother. Your siblings will still be your siblings. Your good friends will still be your good friends. The only people that will not accept you are the people that are not in your circle. So don't go about shaming and blaming and stigmatizing people because of their HIV status. That's not the right thing to do. Okay? Now, I'm going to give us an opportunity to ask specific questions about this topic. So the jury is back. 2 HIV partners can have HIV negative babies. So the clinic is open. Please go ahead and ask your questions. Hello, doc. Can an HIV mother breastfeed? Now, because we know that when you're breastfeeding your baby, you're transferring a lot of things to your baby. So an HIV negative, an HIV positive mother, it's not advised to breastfeed the baby because you can transfer the virus to the baby. So breastfeeding for an HIV positive mother is going to be modified. You're likely going to be placed on formula. So it's not advised. So remember, our aim is to limit the transfer of the virus from you to your baby. So if you're a new mother, HIV positive mother, with HIV negative mother, we're going to start the baby with treatment immediately, then you are not going to breastfeed. Very important. What are we going to do? Because as a mother, your breast milk is going to constantly be produced. There are a couple of things we can do medically to help you because you need to be expressing those breast milk. Once you are a mother and you're not breastfeeding and you're not expressing your breast milk, it's one of the most painful things that can happen to any woman out there. Okay, so breastfeeding for HIV positive mothers, it's not recommended. Medications, does HIV medications have direct effect on becoming pregnant? No connections. Just like you should know, when we give you the HIV drugs, you have to take them exactly how we recommended them. Now, some people might have side effect or adverse effect, whatever it is. There is no connection between HIV medication and infertility. HIV medication does not cause infertility. Okay? All right, correct. HIV is no longer a death sentence. Okay? Will the viral load still remain in the baby after the treatment? No. Remember, the overall aim when we are treating the baby is to make sure that for whatever reason, if the baby is exposed, we neutralize it. This is the same thing that applies to people that might be exposed. So if you're in a hospital and you got exposed to an HIV positive blood, what are we going to do? We are going to give you a prophylaxis, just like we give women that are pregnant anti-malaria as if they have malaria. So when we're giving you anti-malaria treatment, we are trying to counter the possibility that you might be exposed to malaria. So in the same vein, when we are treating the baby, newborn baby with antiretroviral therapy, we are doing that to suppress whatever remnants. So pretty much if we observe everything the way it should be done, the viral load will not even be existing in the baby. The only place you will be thinking about viral load is what? In the mother, because you have already been confirmed positive. But once we don't have any trace of HIV in the baby is not HIV positive. The only time you are confirmed HIV positive is when you have the HIV virus in your body. So if we follow the religious protocol of treating you and your partner, making sure your viral load, there are some people that if you go to their body, the viral load is pretty much undetectable. That's where we want you to be. So if you are HIV positive, your pregnancy must be planned. So you're not just going to be going about trying to make love like other people. No, you need to be careful. So discipline is important to HIV couples. But believe me, you can have the best life, you can have your best money, you can have your best relationship, even in your HIV. You can be an advocate of HIV. Guess what? The Magic Johnson I'm telling you guys about, one of the biggest billionaires in America with HIV, is going about helping people, creating awareness, helping people to live again. So the overall aim is see your HIV like your own burden in life, but carry your burden and survive, thrive. What's the delivery option for HIV patient? This is a very, very important question. Now, your delivery option is going to be a carefully planned process, depending on the progress of that pregnancy. Because remember, in delivery, there are possibilities that the baby will exchange blood with the mother, right? So depending on the progress, if everything went smoothly and we are not really worried, some women might go the route of vaginal delivery, careful delivery, or we will go straight and go for CS. So the delivery option in an HIV positive mother carrying a likely HIV negative mother is going to be dependent on the history. It's going to be dependent on the progress of that pregnancy and the viral load. But the safest option in delivery in that situation is cesarean section. Okay? Okay. Do hospitals carry out fertility treatment like IVF on HIV positive couples? Yes. Remember, if you notice, if you go to the doctors, one of the questions they normally ask if you're going for fertility, they want to know your HIV status, right? So when they know your HIV status, they will manage you as high risk. So they will still offer, nobody has any right to deny you fertility treatment. So even if you have the worst case scenario of infection or disease condition, people that have cancer can still go for fertility treatment. People that have HIV can still go for fertility treatment. So no matter what you have, you can never be denied. The only thing is, if we know you are HIV positive, then we are going to have a comprehensive team that will manage you. So the infectious disease specialist will make sure you are taking your drugs. Matter of fact, some people will use what we call DOT, directly observed therapy. So we make sure you're taking your antiretroviral therapy. We make sure we are keeping an eye on you. We make sure your CD4 cell is coming up. We make sure your viral load is good, but you can still go for your treatment. So women that have HIV positive can still go for IUI, IVF, fertility treatment, just like other people. So yes, they can afford and they should, by default, give you all the services you need, even with your HIV status. Okay? How can an HIV patient, especially the woman who is pregnant, manage social stigma in the hospital? Part of what I'm preaching today is part of dealing with the stigma. The ability to go for counseling, the ability to accept your situation, the ability not to seek for validation, the ability to close your ears, the ability to be grateful and thankful to God that despite the fact you have HIV, you are still standing. There are so many people that died at this moment. So knowing yourself, reclaiming your confidence, thanking God, talking to yourself, taking your treatment, going out there, You cannot hide forever. You need to go out there in the space. You need to accept your HIV status positive. You need to stand for you. You need to advocate for you. You need to be mindful of the people you have around you. You need to be mindful of the organization you belong to. The fact you're HIV positive doesn't mean anybody is going to deny you your options out there. So if you're in an organization and you discover because you're HIV positive and they are stigmatizing against you, you can sue them. So it's mainly about you accepting what you have. And I know it's a very tough place to be, especially as it regards the society where you live. So many people can be suicidal. There are some people that actually kill themselves because of HIV, not because they died, but they committed suicide. There are people that became depressed. There are people that have anxiety problems simply from having HIV positive status. And there are some people that have had HIV for 40 years, for 30 years, and they are busy enjoying their life. That's a fact. There is another life on the other end of the spectrum. The key word is to avoid getting to AIDS. So remember, HIV is not AIDS. AIDS is not HIV. AIDS is a consequence of untreated HIV. So HIV is here. AIDS is here. If you are not careful, you can travel from HIV to AIDS. But you don't just pick up HIV and you have AIDS. Now, with the current dispensation and current modern technology in treatment, only few people actually get to AIDS. If you can take your medications, if you can live healthy, if you can avoid infection, if you can avoid opportunistic infection, you can live a good life. Very important. Okay, is it safe to take HIV medication in pregnancy? 100%. You have to take it religiously. And that's why we need to make sure that whatever HIV drug we are giving you is safe in pregnancy. So women that are HIV positive will still need to take their medication because the overall aim, if you remember, is to reduce the viral load. So long as you're taking those medications that will be suppressing the viral load, you're good to go. So it's safe to take HIV treatment in pregnancy, but it has to be the proper treatment. It has to be the drugs that are allowed in pregnancy. So your anti-malaria, your antibiotics, your antiretroviral therapy must be the type that can be tolerable in pregnancy. There are some drugs you can't take in pregnancy. There are some painkillers you can't take in pregnancy. There are some anti-malaria you can't take in pregnancy. There are some antibiotics you can't take in pregnancy. There are some antiretroviral therapy you can't take in pregnancy. So long as you're taking the right one, you're good to go. Okay? Can HIV virus be transferred through body fluid like sweat? No, HIV is not transferred from sweat. HIV is transferred from blood. Okay, so the major avenue for transmission of HIV is blood. You cannot transmit HIV through sweat. Now, if you have any opening in your body that can communicate through the membranes, you can. So when you're kissing, if you have sores in your mouth, there is exchange of. People can go into deep kissing. There are some people that bite each other when they're kissing. Once we have any exchange of fluid between the mucous membrane, maybe in cause of kissing, you have some little bruises. Once there is communication between the fluid from the man and the woman, you can pick up HIV. But having contact from sweat from someone that have HIV and the sweat touching your body doesn't cause HIV. So stop stigmatizing people with HIV in that regard. Sweat do not lead to contracting HIV. Okay? Now, if you have HIV positive and you're pretending to be using condom and you're not using it properly, you are better off removing that condom and making love without condom. So carefulness, knowing the right way to do things is very important. The only contraceptive that can prevent you from picking HIV is what? Condom, barrier method. But you must use it properly. Very important. So sweat cannot transfer HIV virus. Okay. Do we have any other question? We have 2 more minutes to go. I'm not surprised about the number of people that showed up because, we only show up for fertility-related topic. But this is one of the best topics I can present to this community. So next time you see someone with HIV, if they talk to you in confidence, share love to them. They can still do every singular thing you can do. There are so many amazing HIV clients out there. And stop always thinking it's because they were promiscuous. There are so many people that picked up HIV. Up to now, we can't even trace how they got HIV. There are so many people that were trying to save people in the hospital. They got exposed to HIV blood and they became HIV positive. So it's not only true love making. So stop judging people. Stop thinking you're perfect. Stop thinking you're better than them. You are not in any way better than anybody that is HIV negative, positive. You are not. You're just you. They are them. So allow them be. Stop the stigma. Increase their awareness. Go for love. Who will love you, regardless of your status. Real love is knowing that someone has something and still sticking there. Unfortunately, so many people are opportunists. They want to, pretend they love you because you're the most beautiful girl, or they want to pretend they love you because you're handsome, or you have money, or you're a doctor, or you're this. There is another life beyond the physical. When you see someone that loves you, when you see someone you can connect with, don't allow any status stop you. Go for love. Love is a wonderful thing. Love can conquer everything. Stop trying to live to the Joneses. Stop trying to please people. Stop trying to look for their approval. Stop trying to look for their validation. When you have HIV, you have HIV. When you have cancer, you have cancer. When you have infertility, you have infertility. The most important thing is, what are you going to do? What are you going to do with your HIV? What are you going to do with your infertility? What are you going to do with your cancer? How early was HIV diagnosed? How early was your infertility diagnosed? How early was your cancer diagnosed? Time is of essence. So next time you get into conversation with people that are trying to shame, blame, and stigmatize people that have HIV, stop them right there. Tell them that Dr. Trudy has a good news, that HIV is no longer a death sentence. Thank you for coming this afternoon. We appreciate you. Now, if you're in our group and you are not attending our event tomorrow, you are missing a lot. You are gonna regret this. So if you haven't registered for the workshop, the Believing for Baby ANC combined workshop, make sure you register today. It's gonna be by 9 p.m. tomorrow. It's a couple-friendly event. Come with your partner. Make sure you attend. It's tailor-made for women that will become mothers in 2022 and women that are currently pregnant. So if you are pregnant, there are so many things that will blow your mind away if you attend the event tomorrow. We want everybody to have equal opportunity by 2022 to become pregnant and fulfill their parental obligations. So thank you. I'll see you guys tomorrow. The window for registration is still open. If you're in our Facebook, if you're in our website, please go there, register. Admin, if you can click, if you can share the website, if you're able to share the links, please click on it, go and subscribe. Don't miss this opportunity, and we'll see you guys tomorrow. Thank you for coming and enjoy the rest of your weekend. Bye-bye for now.